Hi, welcome to Gold Medal Home Health. We are excited to have you join our team. We look forward to working with you. Today we will be covering several essential topics including a brief history of Gold Medal Home Health, Gold Medal Home Health's Code of Ethics, key Gold Medal Home Health policies and procedures, compliance and training requirements, Health Insurance Portability and Accountability Acts, tips for acing your first meet and greet, benefits including insurance coverage, PTO, and 401k, what to expect when you first get assigned to a case, and lastly, new employee facts and questions. You will see checkpoint slides like this throughout the presentation. Each checkpoint will consist of 1 to 2 either true, false, or multiple choice questions regarding the section you've just reviewed. Please ensure you have a pen and paper handy to write down the question number and your answers at each checkpoint. There is a brief quiz after this orientation. At Gold Medal Home Health, our mission is to provide compassionate and comprehensive services to individuals with disabilities. The services and support we provide allow the individuals we work with the opportunity to live independent and productive lives as integrated citizens in the community. Gold Medal strives to optimize resources to ensure the individual's outcome and goals are successfully achieved. Gold Medal Home Health was founded in 2012 with a mission to assist individuals with intellectual and/or developmental disabilities to live independent and productive lives as integrated citizens in the community. This focus has resulted in Gold Medal becoming a highly respected service provider in our community. Since 2012, Gold Medal has assisted hundreds of individuals, and we are incredibly grateful for the relationships that have developed during that time. Gold Medal strives to make deeper connections with the individuals and families we serve. Our staff invests the time to get to know an individual and determine how we can help that individual achieve his or her goals. At Gold Medal Home Health, we provide in-home and community-based supports for adults with developmental and intellectual disabilities. Most of our workforce is comprised of our fantastic direct support professionals. We also have registered nurses and licensed practical nurses on staff to help support our clients' needs. Gold Medal deeply appreciates our staff that work one-on-one with individuals daily. The compassion and empathy that they possess is remarkable. Gold Medal Home Health is proud to impact so many lives positively. An individualized service plan is a comprehensive and customized document that coordinates and provides prior authorization for all New Jersey Division of Developmental Disability Services and service providers. The individualized service plan is reviewed with Gold Medal to be sure we work to the best of our ability, providing what supports are needed for the individual to get the best care to reach their health and personal goals. Progress is noted by direct support professionals and discussed with the Gold Medal Home Health Support Services team to be sure needs are met. Gold Medal works with 2 DDD Medicaid waiver programs, the Supports Program and the Community Care Program. Enrolling in one of these programs allows individuals to receive home and community-based services based on their assessed needs and the individualized budget. What programs does Gold Medal Home Health work with? A. Supports Program. B. Community Care Program. C. Answers A and B. Or D. Self-directed employment. The Gold Medal Home Health Code of Ethics was created to help our staff become the best, most well-rounded caregivers they can be. Direct support professionals who support people in their communities are called upon to make independent judgments that involve practical and ethical reasoning frequently. Numerous pressures from organizations, government, social policy, and societal prejudice can shift focus and allegiance away from the people being supported. DSPs face ethical decisions daily and consistently feel the tension between the profession's ideals and its practice. To maintain the promise of partnership and respect that must exist in a supportive relationship, a strong ethical foundation is critical to help DSPs navigate the maze of influence that bombard them. It must be the mission of the DSP to honor the individual path suggested by unique gifts, preferences, and the needs of each person they support. DSPs will walk in partnership with the person and those who are significant to them toward a life of opportunity, well-being, freedom, and contribution. There are 9 tenets of the Code of Ethics. 1. Person-centered supports. As a DSP, your first allegiance is to the person you support. All other activities and functions you perform flow from this allegiance. 2. Promoting physical and emotional well-being and healthy lives. As a DSP, you commit to promoting the emotional, physical, and personal well-being of the people you support. You are to encourage growth and recognize the autonomy of those receiving support while being attentive and energetic in reducing the risk of harm. 3. Integrity and responsibility. As a DSP, you support the mission and vitality of your profession to assist people in leading self-directed lives and to foster a spirit of partnership with the people you support, other professionals, and the community. The safety of those you support and your safety is a top priority. 4. Confidentiality. As a DSP, you safeguard and respect the confidentiality and privacy of the people you support. 5. Justice, fairness, and equity. As a DSP, you affirm the human rights as well as the civil rights and responsibilities of the people you support. You promote and practice justice, fairness, and equity for the people you support and the community. 6. Respect. As a DSP, you respect the human dignity and uniqueness of the people you support. You recognize each person you support as valuable and promote their value within communities. 7. Relationships. As a DSP, you assist the people you support in developing and maintaining relationships. 8. Self-determination. As a DSP, you assist the people you support to direct the course of their own lives. And 9. Advocacy. As a DSP, you advocate for the people you support for justice, inclusion, and full community participation. How many tenets are in the Code of Ethics? A. 4, B. 9, C. 5, or D. 6. In the next slides, we will discuss key gold medal home health policies and procedures, communication and professionalism, clocking in and out, call-outs and late arrivals, compliance, progressive discipline, and the gold standard review. Communication and professionalism. We expect our staff to communicate all needs, changes, and issues that affect your work with the office staff. Gold Medal Home Health takes pride in our communication and the ability to assist and accommodate our staff. The office staff is ready and willing to help. However, we cannot do so if we are unaware of any issues that you may be experiencing. We treat our staff professionally and communicate with as much transparency as possible. We, in return, expect the same from our DSPs. If your care manager or any office staff reaches out to you, we expect you to respond promptly as we aim to do the same. Your professionalism and communication are taken into consideration for your gold standard review. Clocking in and out. Gold Medal Home Health uses a mobile application for time and attendance. This app is used for clocking in and out, documenting visit notes, and confirming the hours you've worked for payroll purposes. We use a geofence, which means you can only clock in and out once you arrive at your support recipient's home. If you are too far from the service recipient's home, you cannot clock in or out. If you are out in the community often and not back in the home to clock in and out regularly, please contact your care manager. If you forget to clock in or out on time or at all, you can submit a request to adjust your schedule to reflect the hours you've worked at goldmedalhomehealth.com/schedule. This is to be used in one-off situations. All direct support professionals are expected to clock in and out using the mobile application. True or false? Gold Medal Home Health uses manual timesheets to keep track of time and attendance. Call-outs and late arrivals. We ask that our staff give as much notice as possible. However, we firmly request at least 24 hours before calling out of work. This time is used to communicate with the family and make appropriate accommodations. All call-outs must be communicated via phone with your care manager or the assistant director or the director of support services in their absence. Leaving a voicemail will suffice if you cannot connect with your care manager. They will then communicate your upcoming absence with the family and support recipient. In emergencies, please give your care manager as much notice as possible so they can communicate with the family and support recipient. A no-call, no-show will result in disciplinary action, including but not limited to a written warning, suspension, or termination. Please note, last-minute call-outs are taken into consideration for your gold standard review. Anticipated late arrivals should be communicated with your care manager immediately. They will then communicate with the family and support recipient. Reoccurring late arrivals may result in disciplinary action. If your availability has changed or you have difficulty arriving on time due to reasons outside of your control, please communicate with your care manager. Sometimes accommodations can be made. Frequent late arrivals are taken into consideration for your gold standard review. How much notice should you give before calling out of work? A, 4 hours, B, as much as possible, C, 24 hours, or D, both B and C. What is compliance and why is it so important? Compliance is a comprehensive program that helps organizations and their employees conduct operations and activities ethically, with the highest level of integrity and in compliance with legal and regulatory requirements. To have an effective compliance program, an organization must establish and maintain an organizational culture that encourages ethical conduct and a commitment to compliance with the law. So, how does this all affect your job? Gold Medal Home Health's compliance program includes the following. Our standard of conduct states what we stand for, how we work together, and how we serve our clients in an ethical and responsible way. Our compliance program is designed to put specific policies in place to make sure that all of us are doing the right thing and doing the right thing well as we work with clients according to both internal and external requirements. Gold Medal is an approved New Jersey Medicaid provider and has developed specific parts of our compliance program to meet the requirements of both the New Jersey Supports Program Manual and the Federal Medicaid Program. Our compliance program is designed to make sure that all of us are doing the right thing and doing the right thing well as we work with clients according to both internal and external requirements. True or false? The Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, is federal legislation requiring the protection of privacy of Gold Medal Home Health's clients' health information while receiving services from our organization. HIPAA regulations give our clients the right to control who will see their protected health information. Our job is to do everything that we can to ensure that our clients' private and confidential information does not end up in the wrong hands. Any communication with or about our clients involving their health information must be private and limited to only those who need the information to do the following: to work with the individual, to possess the service-related information, or to pay for their treatment. So, what is confidential information? When clients give information to their healthcare providers, they expect that only people involved in their healthcare and those who need to know the information will see it. Confidential information includes the reason a person is seeking care at the current time, the services and the medication that he or she receives, observations and summary reports about his or her current or past health conditions, and other entities from which care has been received. It's helpful to ask yourself before looking at any client information. Do I need this information to do my job and provide good client services? What is the least amount of information I need to do my job? This requirement to use or share only the minimum necessary is covered in the HIPAA Privacy Rules section 164.502b. HIPAA's privacy and security regulations list specific fines for individuals and organizations that fail to keep client information confidential. Which of the following options best describes the Health Insurance Portability and Accountability Act, also known as HIPAA. What is identifiable client information? Basically, identifiable information is anything that can be used to identify a patient. Releasing any of this information for other than permissible purposes is a violation of the HIPAA privacy regulation. Examples of what makes information identifiable include the following: names and addresses, dates of birth and social security numbers, telephone numbers and email addresses, member or account numbers, and photographs or fingerprints. As a covered entity, Gold Medal must ensure the confidentiality, integrity, and availability of all ePHI and PHI data we create, receive, maintain, or transmit. We must identify and protect against reasonably anticipated threats to the security or integrity of the information. We must protect against reasonably anticipated unpermitted uses or disclosures. We must ensure compliance by the Gold Medal workforce. And lastly, we must reinforce the expectation that any suspected or actual HIPAA breaches must be reported immediately. True or false? PHI stands for Private Healthcare Institution. Criminal penalties for wrongful disclosure can include not only large fines, but also jail time. The penalties increase as the seriousness of the offense increases. The penalty structure for a violation of HIPAA laws is tiered, based on the knowledge a covered entity had of the violation. The penalty is based on a number of general factors and the seriousness of the HIPAA violation. In other words, selling PHI is more serious than an accidental release. While the least serious fines start at $100 a violation, the most serious categories carry a minimum fine of $50,000 per violation. Even accidental releases of HIPAA-protected information must be reported and represent significant risk to our organization. Please think about each of the following ways you can protect your client's PHI and other sensitive information. Never include PHI information in text messages or on the subject line of an email. Encrypt emails containing PHI or other sensitive information. Never give out information about the individuals we serve or about other employees unless you can definitely verify the identity of the person asking, validate the reason for the request, and ensure that an appropriate release of information has been appropriately signed and executed. According to HIPAA, what client information is not considered confidential? A. Names and addresses. B. Dates of birth. C. Social security numbers. Or D. Hobbies and interests. Progressive discipline policy. Gold Medal Home Health holds our staff to high standards to help provide the best, most reliable support for those we care for and their families. We manage attendance, communication, and other employee-related issues by using a progressive discipline approach. The following are used to help promote compliance and effective working relationships between DSPs, support recipients, family members and guardians, care managers, and other office staff. Verbal warnings, written warnings, and terminations, suspensions, or removal from cases. We do not follow a 3-strike policy. Depending on the severity of the issue, more severe disciplinary actions may be taken first when necessary. Compliance and training requirements. All staff are required to maintain in compliance throughout the duration of employment. Items that may fall under compliance are CPR and first aid, driver's license, car insurance, and training. All DSPs are expected to remain in good standing with CARI, DHS, and Office of Inspector General. Your compliance status is taken into consideration for your Gold Standard Review. Gold Standard Review and Bonus. Gold Medal Home Health is proud of our semi-annual caregiver review that will, for most, be tied into a semi-annual bonus at the general manager's discretion. The review will take place every October and April to review the previous 6 months' progress and performance. The Gold Standard Review is comprised of 4 primary components for our DSPs: attendance, professionalism, compliance, and family and individual satisfaction. Family member caregivers will be reviewed in all areas but family individual satisfaction. Instead, their compliance portion will represent 50% of their potential bonus. Which answer is not one of the 4 primary components of the bonus in the Gold Standard Review? A. Attendance. B. Professionalism. C. Compliance. D. Family individual satisfaction. Or E. Hours worked. Bonus structure and eligibility requirements. While all DSPs actively working by the end of the review period are not entitled to a review, not all caregivers are entitled to a bonus. To be eligible to receive any bonus, a caregiver must be employed by Gold Medal Home Health for at least 6 months, work an average of 7 hours a week or 182 hours in the 6 months, and be actively working during the last pay period of the review period. The Gold Standard Review bonus structure is based on your employment tenure and your current status. Reviews occur twice a year. Bonus potential increases over time. If a caregiver becomes inactive for an extended period, the clock for 6-month minimum employment requirement may be reset. What are the eligibility requirements to receive the bonus in the Gold Standard Review? A. Be employed by Gold Medal Home Health for at least 6 months. B. Work an average of 7 hours a week or 182 hours in the 6 months. C. Be actively working during the last pay period of the review period. Or D. All of the above. Gold Medal Home Health's Employee Referral Bonus. Employees must document referrals at goldmedalhomehealth.com/employee-referral. Both employees must be actively working and in good standing at the time of the payouts. The referred employee must work an average of 10 hours per week for the bonus to be paid at each milestone. The referral bonus will be spread throughout the first year of the referred employee's tenure. The outline of the payouts is listed below. It's important to remember that you can earn up to $1,000 for each referral. There is no limit to how many referrals you can make in 1 year. In the next few slides, we will review benefits, including insurance coverage, PTO, 401k, and other important HR policies. Gold Medal offers a generous comprehensive benefits package to those eligible, including but not limited to medical, dental, and vision coverage, tenure-based PTO policy, life, short-term disability, and long-term disability insurance, and a 401k retirement plan. New staff are eligible for medical benefits the first of the month after their first 60 days of employment if they have worked an average of 30 hours a week or more within their first 60 days. After your first 60 days, Human Resources will contact you and provide the summary of benefits offered for that calendar year, along with the enrollment paperwork. There is a 6-month wait period before being eligible to enroll in our 401k retirement plan. This plan is managed through our payroll company, and you will receive information from them regarding enrollment as you reach the end of your waiting period. Gold Medal offers a 100% match to the first 4% of your overall contribution percentage. There is a 4-year vesting period. Gold Medal's PTO policy is tenure-based. The longer you work for Gold Medal, the more PTO you can earn, the highest tier being after 7 years of employment. PTO can be used for vacation, personal, sick, and bereavement time off. You begin accruing PTO your very first day, and there is no waiting period to be able to utilize your hours of PTO. Time off can be requested through the Gold Medal Action Form. You will receive the request form link when you are assigned to your first case. Gold Medal provides stress-free financial control by offering on-demand pay benefit using TapCheck. TapCheck allows employees to instantly access their daily earnings, make quick transfers, and avoid penalties. TapCheck also offers resources to help you leave financial stress behind. Get started today by downloading the TapCheck app after this orientation to sign up and access your earnings on your first week. True or false? Through Gold Medal's employee referral program, you can earn up to $1,000 per referral. What to expect moving forward? Your first official day as a Gold Medal Home Health employee is your first day working on your first case. The timing of first case assignments vary due to several key factors. Things to consider are location of the cases, available shift times, level of care required, and the service recipient's caregiver preferences. To help ensure that your placement can be successful long-term, you will have the opportunity to attend a meet and greet or family interview before being assigned any case. Think of a meet and greet as a second interview. This is an opportunity for you, the service recipient, and their family and guardians to get to know one another and make sure everyone will be comfortable with the case assignment. Making a good impression during a meet and greet is very important. Being assigned a meet and greet does not guarantee you the assignment. All open cases are listed on goldmedalhomehealth.com/jobs. You can express interest in cases that may be a good fit for you directly through the site. Once you express interest, you will be provided with more client-specific information before scheduling your meet and greet. Here are some tips on how to ace your meet and greet. Arrive early. Arriving 5 minutes early shows the family you can manage your time appropriately. This is an easy way to put your best foot forward when you make a first impression. Be sure to not only introduce yourselves to the family member or guardians, but also the service recipient. This is the first interaction they will witness between you and their loved one. Show them your focus is also on the individual and that you can engage with them. Be sure to bring a pen and paper with you when going to a meet and greet so you can take notes. This will allow you to jot down any questions you may have or make note of essential items that you don't want to forget. This also shows the family that you are serious about patient care. Dress appropriately. Keep your attire clean and straightforward. Make sure you look presentable. We recommend solid colors. We want them to remember you, not your wardrobe. Avoid all cell phone use, including work phones. Being present during your meet and greet is essential. Try to avoid all cell phone use unless it is an absolute emergency. We recommend silencing your phone before entering the home to avoid any distractions. We also suggest removing headphones from your ears even if they are not on. Keep these tips in mind going forward. They are best practice as a general guideline even after being assigned to a case. True or false? A meet and greet is an opportunity for you, the service recipient, and their family and guardians to get to know one another to make sure everyone will be comfortable with the case assignment. How can you ace your meet and greet? A. Arrive at your earliest convenience. B. Introductions. C. Note-taking. D. Dress appropriately. E. Avoid all cell phone use. Or F. Answers B through E. You were just assigned your first case. Now what? When you are assigned to your first case, you will receive the following documents to help you become familiarized with Gold Medal Home Health's office staff, practices, and expectations. You will receive the following: the organizational chart, the office staff directory, the online directory, a payroll calendar, the mobile application clocking in and out instructions, the employee handbook and code of ethics, and lastly, you will be assigned a mentor who, along with your care manager, will help answer any questions you may have related to Gold Medal, your service recipient, or your role's general responsibilities. Here are some frequently asked questions. Can I be assigned to more than one case? Yes, we encourage our staff to take on additional case assignments to reach their goal of working full-time if they desire. Who will I report to? Each case has its own care manager. You will report directly to the care manager assigned to the case you take on. If you take on multiple cases, you may have more than one care manager to report to. How can I learn about what cases are available? All of our open cases are visible for you to show interest in via goldmedalhomehealth.com/jobs. Where can I access my pay stubs and my other employee information? All of our payroll information will be available to you on the mobile app for the payroll company. You will be given access to the payroll company portal via email once you are assigned your first case. We strongly suggest you download the payroll company mobile app when the time comes and familiarize yourself with the platform. How do I request a day off? You can request a day off through goldmedalhomehealth.com/schedule. This information will be shared with the appropriate office staff, including your care manager and the payroll manager. We will communicate with the family on your behalf. How do I call out sick? When you need to call out sick or have a last-minute emergency, it is always best practice to call, not just text your care manager or the care manager on duty after hours. Who should I call in an emergency? My care manager or the service recipient and guardian? Generally, your care manager should be your first point of contact. In the event of a life-threatening emergency, please call 911. As a family member caregiver, can I change my schedule? Whether it's a one-off change or an ongoing change request, all schedule changes must go through your care manager. We are happy to adjust schedules, but they must be communicated first. Do I have to be home to clock in or out? Yes. In most cases, you need to be within a certain distance of the individual's home to clock in and out. However, if you are frequently out in the community during clocking in or out times, please bring it up with your care manager. We can adjust the system to allow you to clock in or out further from the home. What do we do if the individual for who I provide services would like to go on vacation and want services to continue while on vacation? Services can be provided anywhere within the continental U.S. for up to 30 days outside of New Jersey. Services cannot be provided outside of the U.S. and its territories. Who should be your first point of contact in a non-life-threatening emergency? A, the care manager, B, the client, C, human resources, or D, all of the above. Here are some common missteps and ways to maintain a professional relationship as a caregiver at Gold Medal Home Health. Talking to your client about your personal life or problems may be tempting. Doing so may cause the client to see you as a friend instead of a healthcare professional. As a result, the client may take on your worries as well as their own. Here's what you can do to help stay in bounds. Use caution when talking to a client about your personal life. Do not share information because you need to talk or help you feel better. Remember that your relationship with your client must be therapeutic, not social. Maintain a professional boundary. Do not exchange social media. Sometimes caregivers react emotionally to the actions of a client and forget that those actions are caused by a disorder or disease. Personal emotional responses can cause a caregiver to lose sight of their role or miss important information from a client. In a worst case, it can lead to abuse or neglect of the client. Here's what you can do. Be aware that a client's behavior is a result of a disease or disorder. Know your client's care plan. If you are about to respond emotionally or reflexively to the negative behavior of a client, step back and reapproach the client later. Note that the client may think that their action is the best way to solve a problem or fill a need. And lastly, ask yourself if there is a way to solve the problem and help the client communicate or react differently. Calling a client sweetie or honey may be comforting to that client, or it might suggest a more personal interest than you intend. It may also point out that you favor one client over another. Some clients may find the use of nicknames or endearments offensive. Instead, avoid using terms like honey and sweetie. Ask your client how they would like you to use their first name. Others might prefer a more formal approach like Mr., Mrs., Ms., or Miss. Remember that the way you address clients indicate your level of professionalism. Here's how to be a successful DSP at Gold Medal Home Health. Be compassionate. Our DSPs have compassion for serving individuals with developmental or intellectual disabilities. They understand the importance of our mission and believe they can help transform the lives of those we serve and their families. Compassion and patience are key traits of a DSP, as well as kind and understanding demeanor. Be helpful. Our DSPs wear several hats daily. They may be asked to assist with everything from managing medication, completing job applications, cooking light meals, or using public transportation. Being helpful in this field is not to say you will be doing the task for those you support, but rather help them as they learn to independently perform these daily living skills. Be dependable. We understand life can be unpredictable and unexpected issues can occur at any time. Keeping that in mind, our most successful DSPs maintain the highest level of dependability and communication with our office staff. The individuals you will support will begin to look forward to the time you spend together and will expect you to be there at your scheduled time. We appreciate our DSPs who keep this in mind and do their very best to be reliable for the individuals they serve. Be a team player. While you will be wearing many hats in this role like teaching, cooking, assisting, and cleaning, the most important is being a supportive presence. Those you serve need compassionate and understanding support who can celebrate their personal victories and help them move forward toward reaching their goals. Be empowering. A successful DSP understands that empowering the individuals they work with is key to transforming their lives. The main focus should be to create opportunities for and with people with developmental disabilities. Offering various opportunities to learn and grow, we hope to empower individuals to live dignified and more independent lives. Doing so helps give those we support a sense of self-worth, but also allows their family the pleasure of seeing their loved ones moving closer towards independence each day. Be professional. We recognize the value in your role and take pride in how we show our appreciation for our direct support staff. We treat each other respectfully and with understanding, and our DSPs are expected to do the same. In every interaction with those you support, their families, and all others involved in your client's care, you are representing Gold Medal Home Health. A successful DSP maintains a level of professionalism with all those they engage with regarding their support recipient. Welcome to Gold Medal Home Health. We look forward to you joining our team. If you have any questions that we did not address, please do not hesitate to contact your recruiter or other office staff to get answers. We are happy to help.